Well, this has been just a phenomenal webinar, and thanks to all the participants, the panel, the presenters, the audience for great questions and comments. I think they were really uh, contributed greatly to the success of the program. I'd also like to thank the IAS-USA staff and Capital Audio, who has been really professional in helping us get this together. I do feel like it's worth also commenting on the whole process of how guidelines are done for folks who really have never participated on a guidelines panel. It's really important to have a group of people that can express their ideas in a way that is firm but without rigidity. And sometimes we're on the cutting edge of things. We try to push things to the limit of knowledge, and also with the understanding that even if there isn't full data sets, people still have to make decisions in the clinical practice. And this panel over the years has been phenomenal at really understanding the nature of the data, what where their limits are, but then translating that into what we do clinically. And I think that showed up again for this year's update. Uh, I would imagine there'll be another update in a couple of years. And in the meantime, if there's any changes that are dramatic, like we did last time with a mid-cycle, if you will, update on the use of cabotegravir rilpivirine in the setting of detectable viremia, which was really kind of a breakthrough thing that I think has helped a lot of patients who have been having trouble. That's just an example, but I just really treasure my involvement in the guidelines over the years, because it's just a remarkable experience working with such knowledgeable people, but also such affable people who know how to get along and play well in the sandbox together. So thanks to everybody for that. Um, I don't know if we have, Fatima, any closing slides. Yep, here they are. Just remind folks your feedback is really important to get your CME and uh, complete the evaluations with the post-test assessment. Uh, this will all be emailed to you by 5 p.m. Pacific time tomorrow. That'll be early in the morning for people in France, and midday for those who live in Australia. This is a podcast that IAS-USA is sponsored, that I've been privileged to lead. I had an interview with Dr. Gandhi that will launch. Actually, it's already launched, so you can access that, where he goes into, in a 25-minute period, what's new in the guidelines. You heard it in great detail here, but it's summarized there. Coming up on December 16th, I guess that's Monday, Doctors Benson and Gandhi will be talking about treatment and prevention of HIV-associated tuberculosis. Lots of changes there. New York, we have a live meeting with the IAS-USA. It's one of the largest ones that we have. Again, it will be at the Skirball Center in New York City on March 24th. There'll be updates on CROI. There'll be updates on STIs, syphilis, prevention of anal, cervical, and oropharyngeal cancer, prevention updates that will pick up where we've left off today, and primary care guidelines. We're also going to be having a treatment regimens webinar for care models for older people with HIV. And we have two folks from New York City who are going to be giving us an insight into how gerontology fits with what we're doing. And then our annual update on HIV in Atlanta, Georgia on April 2nd. So it's a large number of updates. Yet another webinar here with Roger Bedimo and Sylvie Rajagopal to talk about things. And then Dr. Del Rio chairs a viral update for urgent viruses, meaning viral outbreaks that are happening. There's one going on in the Congo right now last I heard was about 450 people who have this respiratory disease, about 140 of whom have died. So that's something to keep our eye on, not knowing what the cause of this is, but this is a type of update that's given in this ongoing dialogue that Carlos chairs. CROI 2025 in San Francisco. Should be a great meeting. The registration is now open, as well as late breaker submissions. So if you have data you'd like to present, now's the time to get it in. And then something new, it's in the International Antiviral Society USA. This is a bacteriophage. Of course, it's a virus, but using it to treat bacterial disease that's pan-resistant. And this is a new area that the IAS-USA is getting engaged with. There's going to be a large meeting October 12th to 14th at the Washington Hilton in Washington, D.C. So thanks everyone for participating. It's been a wonderful afternoon. Really grateful for everybody's active participation, and we hope to see you at the next webinar or in-person meeting, including CROI. So thanks again.